We have an audience here in person, but we also have an audience for this event on Facebook Live and Mayo Connect. So I wanted to let all of you know that this presentation will be viewcasted on social media. None of you will be videoed during that time. Facebook and Mayo Clinic Connect is an online community where people can connect with others to share experiences and learn from one another's journeys. And at the end of the presentation, we are going to answer questions from viewers in the room, like yourself, as well as the viewers that are going to be online. So if you're watching online, please leave your questions in the comments section. And if you're here in the room, please write your questions on the note cards that are in front of you. Okay? So now that we had the formalities kind of out of the way, now I get to be myself. So first, I want to thank all of you for being here with me today. And I want to also thank our live viewers for tuning in. I think that we're going to talk about some very important aspects of breast cancer, the breast cancer journey, and specific to survivorship. This month is October. We're at the end of October, but this month is in honor of all of you who are with us today. And it's estimated that 30 to 86% of breast cancer survivors make healthy lifestyle changes after their diagnosis. And the reason we're here today is to make sure that those lifestyle changes are the right things. We want you to be informed and informed by evidence. And I've worked with a lot of you, and I recognize a lot of you, and I see one person specifically today who's had an amazing transformation. So it's really empowering for me as a physician to not just be in a room with one patient, but to be in a room with multiple people, or to be able to connect with people in an online community maybe that don't have the access to our care. So congratulations to all of you, and thank you for being here. I also want to extend a very special thank you for the reason we're here today. And this is from the Florida Breast Cancer Foundation, who provided me with a grant to organize this event. And I want to thank Mr. Lawrence Mendlow, who is in the back of the room. He is on the board with the Florida Breast Cancer Foundation, and it's because of them that this event is possible. So thank you so much, Lawrence, for being here today with us and for all you've done. Thank you, thank you. And we want to thank Mayo Clinic as well for being so fully supportive, as they always are, with every element of making a patient's life matter, from clinical care to the academic to the education. And that's very important to us, and it's a reality, and so it's really good to be here today. So with that, let's talk about the objectives. What we're going to talk about today, we're going to talk about the purpose of a survivorship care plan, what it means to be a survivor. We're going to discuss the potential late effects of treatment. A lot of patients have experienced these late effects, but maybe they're not quite certain exactly what that means. We're going to highlight the signs and symptoms of a breast cancer recurrence. And this is something that I think is very important to speak to all of our breast cancer survivors about, or any cancer survivor, so that they know they don't have to live in fear, okay? We're going to review the American Institute for Cancer Research cancer prevention recommendations from 2018, which are incredibly powerful because these recommendations are set in place to help prevent cancer, but they're also there for cancer survivors. Lifestyle recommendations that can help us live better after a diagnosis of cancer. We're going to analyze the associations between lifestyle and improved breast cancer outcomes, and we're going to examine that available evidence. So cancer survivorship is extremely important. It's essential that we embed the importance of survivorship to every cancer patient we care for. There are over 3.5 million breast cancer patients in the United States today. So we need to make sure that we're educating patients one by one or in groups. And Dr. Mullen, back in 1985, was a physician who experienced cancer personally. And he was very frustrated with how the cancer journey was experienced. And so he published in the New England Journal of Medicine, The Seasons of Survival, or if you may, these stages of survival. So you're actually a survivor at the time of diagnosis, and you remain a survivor for the duration of your entire life. And so the acute survival phase is when we have tons of support, right? This is the time when we need support the most. Our family's there, our friends are there, the medical community's there. So I don't think that we have as much of an issue during acute survival with support. But the problem is when it comes to extended survival and permanent survival, this is when we struggle. And I myself am a cancer survivor of 19 years. I had non-Hodgkin's lymphoma my first year of medical school. And so I understand what it's like to be a cancer survivor. And for me, it was after treatment was completed that I didn't know what to do. And this is a safety net. I had no safety net. And so what I invite patients to think about is to give yourself time, communicate with your family, and accept that your care will change as treatment ends. So I think we know we need to give ourselves time, and most patients figure this out on their own. And I also think because our families love us and are so supportive, as are our friends, the second thing happens too. But this third thing doesn't happen, or at least it used to not happen very well. And the Commission on Cancer, they have recommended and mandated that all accredited cancer centers provide cancer survivors with survivorship care plans. And so basically, the survivorship care plan is there as your safety net. It's there to help educate you and guide you, as well as your primary care physician, about all the treatments you've experienced, what your diagnosis was, what the stage of your disease was, as well as wellness recommendations. But in my opinion, what's happened in the medical communities across the country is we're checking a box. So many of you probably have a survivorship care plan, and many of you probably don't feel that it really optimized your well-being. So when I had heard about this opportunity with the grant through the Florida Breast Cancer Foundation, I thought, aha, this is my purpose. I can perhaps help cancer survivors be more well during their cancer journey. Cancer is an incredibly teachable moment. So this is when we want to be able to kind of get in the heads of all of our patients and help them because they're thirsty for this knowledge. And so what do patients do if they don't get it from an evidence-based, reputable source? They go online, and oftentimes it's not reputable. So for those of you who are listening to us online, if you don't have access to a survivorship care plan, at the bottom of this slide, I have the American Society of Clinical Oncology website where you can find a cancer survivorship care template. The second link here is another site you can go to online where they have a beautiful data entry that you yourself can complete, and it generates a very thorough care plan. Now, for those of you in the live audience, at Mayo Clinic, we provide survivorship care plans for our patients. And you are our first group of women and gentlemen going through this survivorship care plan wellness retreat as part of our survivorship care plan delivery. So you will be receiving your survivorship care plan in your portal or at your next medical oncology or survivorship visit. For those of you that have already received your survivorship care plan, we'll send you an updated copy because we're on a new electronic medical record now. So the new survivorship care plan will appear like this. You will see that you will have your name, and specifically at the bottom of your care plan, you'll have your treatment team, you'll have the stage of your diagnosis, both the clinical and pathological. You'll have your treatment summary. So this will go over everything from the time of diagnosis to what treatments you received surgically, chemotherapy, radiation, the lifetime toxicity doses, as well as a schedule of the surveillance testing recommended for you. So if you retain your breast tissue, you still need to do mammograms. When do I do it? Do I do it 6 months after radiation? Do I do it a year after radiation? The recommendation is a year after radiation, but how are you to know that if we don't outline this for you? So this is the purpose of the survivorship care plan. But what I find is where we fail our patients in the survivorship care plan delivery is what we're going to talk about today. And that's the wellness recommendations. That's the, doctor, what do I experience if my cancer's coming back? How do I know when to worry? How do I know when to just relax? Or, gosh, I have all these side effects. What do I do with these side effects? So the first thing we're going to talk about is late effects of breast cancer treatment. And there's many, as you know. And I know many of you listening here today may be experiencing one or two of these, or maybe even more. So we kind of go from head to toe, right? So there may be memory loss, mood changes, chronic fatigue. I recently had a patient reach out to me, and she said, Dawn, I'm feeling like my memory just isn't as good. You know, I don't think it has anything to do with her breast cancer. I looked at her medical history, and she has a strong family history of Alzheimer's dementia. So we set her up to meet with our memory specialist to do some special testing in neurology. So maybe it has nothing to do with cancer. And here she was thinking, oh my gosh, my cancer's back. When instead, in my mind, I'm thinking, she has a family history of this. Let's get this question answered. But to go on, cataracts, tamoxifen is a risk factor for cataracts. So it's important you have an ophthalmology appointment just to do a nice baseline exam. Cataracts are very rare with tamoxifen, but still, optimization of those baseline examinations are important. Peripheral neuropathy, lymphedema, pulmonary fibrosis, cardiac toxicities, weight gain. This is the biggest thing, weight gain. A lot of women struggle with this. Why? Because, when we think about a cancer patient, you envision someone with cachexia, or what that means is someone that's really thin and wasting. But that's not what we really see clinically. And the reason is because a mammogram, we detect cancers much earlier, so patients aren't being diagnosed at a late stage in disease. And a lot of the treatments we give them interrupt the hormonal balance, and or they are direct medications that can cause weight gain, like prednisone. We can see kidney or bladder issues. We see a lot of the sexual side effects from treatments like hot flashes, vaginal dryness. And we can see joint pains, osteopenia, osteoarthritis. These are all things that you shouldn't be struggling with. These are all things we can help you with. So please report these symptoms to your medical doctors so we can get you help so you can live a quality life. That's very important. There's no reason to beat cancer only to not live with full vitality. So here's the biggest one. This is the elephant in the room. Oh my gosh, recurrence. So how do I know when to worry, when not to worry? And I know myself personally, this was the hardest thing, and it's still quite honestly a hard thing. It's always in the back of your mind. I don't think it ever leaves. I also think it's part of being a very responsible patient. So the recommendation I give to patients here is if you have a symptom and it's taking place for 2 to 3 weeks and you don't have an explanation, it's probably time you talk to your doctor. If you have a severe symptom and you're fearful, it certainly wouldn't hurt to talk to your doctor earlier. So make sure to have that open dialogue with your medical care team. And what I say is let's harness fear and cultivate empowerment. I mean, that's really what we're here to discuss today, is let's use cancer and leverage it to make us stronger individuals. Again, looking at cancer as a teacher of life. So, ooh, gosh, now I'm really pulling out the science. I had to do it to you. But this really drives home why living well matters. And the World Cancer Research Fund, the American Institute for Cancer Research, provide this slide about the cancer process. And the cancer process is a multi-step process. We all have cancer cells, or the ability to make cancer cells in our body every single day. But it's when something goes kind of out of harmony or homeostasis that things go awry and cancer can form. And we know that there's multiple contributing factors, so there's host factors, maybe things we're born with, maybe genetic mutations, what have you. But then we know there's some preventable factors like diet and lifestyle and environmental. And it's the combination of all of these things that can propagate this process to cancer. And here I do it to you again, a really complicated slide. But these are the 8 hallmarks of cancer. These are reasons why cancer cells take off and grow and do the nasty things they do. And we have 2 enabling characteristics of the cancer pathogenesis. The one is genome instability and mutation. The other is tumor-promoting inflammation. Big buzzword, right? We buy supplements all the time because they tell us it reduces inflammation. But this is very complex, and so as you can imagine, a supplement in and of itself probably isn't going to do it. Bottom line there is there's really not a magic bullet. Bottom line is we really have to demonstrate really good self-care. And you have to show up for yourself. You got to be there for yourself and believe in it. I love this picture. So I think this is how it goes. The faucet is on, the drain is clogged, and water is flowing all over the floor. And in medicine, we're really good at mopping up the floor. And in fact, we need to mop up the floor. We need to clean up the mess, right? We need to get rid of cancer. So this is our surgery, our chemotherapy, our radiation, our immunotherapy, our anti-estrogen therapy. But the problem is we know that about 42% of all newly diagnosed cancers are completely preventable. So from a prevention standpoint, I think we need to listen to those powerful words. And we know that about 19% of all cancers don't have to happen if people don't smoke, and we know another 18% don't have to happen if people maintain their body weight, exercised, and didn't drink enough alcohol. So I certainly think that this slide is not there to beat ourselves up, right? But the slide is there is something that can be that empowering motivation that says, hey, this is my aha moment. This is my wake-up call that I have some control over my disease. So we look back at this picture and I say, so what can we do as healthcare providers to help patients? And we need to turn off the faucet. This is how we live. Turn off the faucet. Let's eat better. Let's exercise and move more. Let's manage our stress. Let's optimize our relationships. Let's enjoy life. So the World Cancer Research Fund Cancer Update Project set forth these cancer recommendations in 2018. And these cancer recommendations are for prevention, but you see here where this arrow is, they're also there for cancer survivors. And so the first thing we're going to talk about is be a healthy weight and the importance of being a healthy weight. And over 41% of U.S. women older than the age of 20 are obese in the United States. This has become an epidemic. In the United States is this top line, and you see the obesity epidemic continues to rise. We look here, and this is startling, because more than half of all women who undergo adjuvant chemotherapy, that's chemotherapy following the surgery for early-stage breast cancer, experience weight gain. You are not alone. This is a real thing. This is not your fault. This is part of what we've done to your body through our treatments, but there are ways to mitigate this. We know that only 10% of women who have this weight gain can get back to their pre-treatment weight because it's so hard. So how can we help you? And weight gain after a breast cancer diagnosis doesn't help the outcome overall. So this is really something we need to harness and help our patients with. And we go back to this complicated slide again, but this is why I go back to it, because we see here where all these arrows are, this is where obesity goes in and it interferes with the body's ability to optimize overall health, well-being, keeping the cancer away for good, and improving overall survival. So next we're going to talk about how can I help to optimize my weight? What can I do? Okay, that's great. Thank you for telling me it's a problem, but what can I do? And the first thing is not do this. You can't sit around. You got to get up and move, okay? Now, I'm not helping. I'm keeping you sitting here for a really long time today, so I'm going to try to be mindful of that. But we want you to be physically active. You want to move every day, walk more, sit less. Again, this recommendation is set forth by the American Institute for Cancer Research. And 31.5% of all cancer survivors have not exercised in the past month. So maybe it's because we haven't gotten this knowledge out there. Now, this exercise doesn't have to be blood, sweat, and tears. Just be active. Do something you enjoy. Just move a little bit more. The benefits of exercise are huge. I mean, I kept on going on this slide, and finally I had to just pick my top ones. And these are the areas that have the most research and evidence base to show these profound benefits. The first few listed are those that contribute to reduced breast cancer recurrence and improve survival and outcomes. It's going to decrease insulin, which is very tumor promoting. It's going to decrease estrogen, which for a lot of breast cancers, as you know, there is a link to estrogen for those of you that have hormone receptor positive cancers. Obesity and lack of exercise contributes to certain growth factors. It's going to improve your body composition, so it's going to give you more lean mass, more muscle, which is really favorable, and get rid of that fat. We're going to stimulate the immune system. We're going to help to target and inhibit inflammation. You feel better. Your quality of life is better. Research after research after research study shows you feel better when you exercise. And I think rather than scare patients with fear tactics about if you don't exercise, this disease happens, and this disease happens. You got to try to motivate your patients to exercise, get them feeling better, and once they feel better, they've got the buy-in, and they're never going to stop doing it. It's going to reduce anxiety and stress. When you move, you use up some of that adrenaline, and it's not there to make you irritable, anxious, and worried all the time. So it really is profound with mood. You're going to have more energy, and you improve your overall physical functioning. There's emerging evidence with really exciting benefits, including bone health. We know about that. Cardiovascular benefits, memory benefits, reduction in falls, improvement in chemotherapy-associated pain like peripheral neuropathy, and improvement in sleep. So show me really, how is this going to help me as a cancer survivor? It is profound what these research studies have shown. So the Nurses' Health Study, a very large study that was done on a population of nurses, and they looked at this subset with breast cancer, showed that breast cancer survivors who exercised 3 to 5 hours a week, and the more they did, the more benefit they saw, had a 50% lower risk of breast cancer coming back, breast cancer death, or dying from any cause. That's 50%. That's powerful. We look at the next study, again, 50% lower risk of death. We look at the next study, we see a 45% lower risk of death. And I really like this Women's Healthy Eating and Living study because it didn't just look at exercise 30 minutes a day, 6 days a week, but it also added 5 servings of vegetables and fruits. And we know that's going to be the next thing we talk about. And that improves survival advantage by 50%. So big, huge numbers. These are big, respected studies. So huge benefits with exercise. So what about how we can help people feel better, specific to breast cancer? Well, aromatase inhibitor joint pain is a very common thing. And again, it's very real. And it's estimated that up to 30% of patients experience this joint pain. And we see a very simple home-based exercise program that was implemented where women were told to walk at home. And we see that they reduced their joint pain by 10%. They had a 32% reduction in stiffness, and they had a 19% reduction in fatigue. So, great study, but what if the doctor supervised you while you exercised? What if we were watching you under a microscope? We saw that there was a 29% decrease in that pain-related score. So maybe the supervised exercise is even a little bit better. So how much activity is enough? Well, we want you to be in control of that. We want you to work up to 30 minutes a day. That's the goal, but I don't think you need to go to 0 to 60 in 24 hours. So work up to a goal of 30 minutes a day. How hard should you exercise? Well, I think for it to be enjoyable for most patients, they probably want to be able to carry on a conversation. But if women enjoy more vigorous activity, well, you can push it a little bit harder. How many days a week? 3 to 5. Again, we saw in that nurses' health study, the more they did, the more benefit they got. So if you exercise every day, you're probably going to feel better on the days you exercise. And any form of exercise that's rhythmic and continuous is considered aerobic activity. And you have this handout that was provided to you in the materials you were provided today. What about strength training? This is very important, and we really want to encourage patients and all people to try to get at least 2 days a week of strength training. It's very important to maintain your lean muscle mass because that's what helps to drive your metabolic rate. So we want to maintain that muscle. That's really critically pivotal in terms of the importance of exercise. And secondly, we know that strength training helps to strengthen bones. And many of the medications we give to breast cancer survivors, inducing menopause and the aromatase inhibitors, reduce bone density. So the resistance training can help to not cause quite as dramatic of a bone loss. So do you need an exercise prescription? Well, some patients may, and so what does that mean? So if you don't have any health-related issues or any complications from your treatment, just go exercise. But if you're a woman or a gentleman post-treatment who's experiencing peripheral neuropathy, arthritis, or any other musculoskeletal symptoms, lymphedema, or bone-related loss, then you do need, and it is recommended, to have a medical evaluation prior to beginning exercise. You can consider a referral to an exercise specialist to write up what exercises you do, but you don't have to do that. But what patients need to have a little bit more direction from the medical establishment, from experts in this area of medicine. Probably individuals who have cardiopulmonary disease, recent lung or abdominal surgery, which really isn't our population we're speaking to today, gait instability where someone's at a fall risk, extreme fatigue, nutritional deficiencies, worsening clinical condition. Let's say that a woman has lymphedema, but it's getting worse. Not because of exercise it's getting worse, but maybe it's just getting worse on its own. Maybe it's getting worse because you're not exercising, actually. But in any situation where you have a condition getting worse, it would be a reason to make sure you talk to your medical team. Or let's also maybe include bone metastases or other issues like that. These would be people that we actually want you to see a doctor of medicine who prescribes exercise. And as I shared with you earlier, at the end of this lecture, we're going to have a question and answer session where Dr. Rosario is going to join us, who is an exercise specialist. He's a doctor of physical medicine, and he's going to be here to answer exercise-related questions. So the next section from our cancer recommendations is going to be talking about nutrition. This is a huge contributory element of weight gain, and in optimizing our nutrition can really help us to reduce that weight. But also there's powerful recommendations with plant-based diet that we can reduce inflammation, we can improve antioxidants, and improve cancer outcome. So we want to bridge the gap. We want to get you from the left side of the screen, from this sad standard American diet, to the right side of the screen, a very nutrient-rich, bioactive, plant-based diet. And so this to me is the best diet. Something that's kind of right in the middle. It's a Mediterranean diet There's nothing restrictive about the Mediterranean diet, and time again, it is called the world's healthiest diet. But we're talking about breast cancer day, so doctor, show me the evidence. Like, what do you mean? How can it help me? There is strong evidence that the Mediterranean-type diet is the best diet to decrease the risk of being obese, overweight, and it helps reduce weight gain, all of which improve breast cancer outcomes. And we will find this in these American Institute for Cancer recommendation guidelines. So what is the Mediterranean diet? Again, it's that plant-based diet where we have a strong emphasis on non-starch vegetables, fruits, whole grains, beans and legumes, nuts and seeds. Let's get rid of the butter and instead replace it with extra virgin olive oil. Use herbs instead of salt. Try to limit red meat to a few times a month. Consume wild fatty fish 2 to 3 times a week. Enjoy meals with family and friends. And all too often, this doesn't happen anymore. Very few American families sit down with their loved ones to have a meal. And so we kind of need to get back to those basics. You know, we don't want to eat our meals on the go. We don't want to eat our meals with our cell phone in front of us or our computer in front of us or while we're driving our car. And exercise. We just talked about exercise, but it's also part of the Mediterranean diet. So how could this not be my favorite diet, right? One suggested modification for my patient population, though, is we want to kind of yank out the alcohol part of it. So several years ago, when I used to do this presentation, oftentimes I use the same backgrounds. There used to be this wine bottle, so I had to find a different background because I don't put the wine bottle on there anymore. I thought, it's time we get rid of that. So let's talk about this study. I think that it's a very small study, only 300 women, but it drives home a really powerful point, and there's a direct connection of this study to you ladies and gentlemen here. So 300 breast cancer survivors with a history of early-stage breast cancer. What is early-stage breast cancer? That's stage 1 to 3 breast cancer. A lot of patients think it's just stage 1 breast cancer, but no, it's stage 1 to 3 breast cancer. 199 women opted to do the Mediterranean diet, and the remaining patients stuck to their normal diet. After 3 years, there were 11 women that had breast cancer recurrence, all in the regular diet group. Now, this study needs to be followed for a longer period of time, but the data was statistically significant. And so this is really exciting. And again, it's not a restrictive diet. It's an easy diet to follow. So oftentimes patients think, so do I need to do this every single day? You can ask me, do I do it every single day? No, what I ask my patients is 90% perfect. So my nutritionist who's going to be on the panel isn't here right now, so that's why I said it now, okay? She's going to say 100% perfect. She's really hardcore, but I'm the real person. I've had cancer. I don't think she has. So we want to live, okay? And I was talking to another lifestyle expert recently, and this person, I will not say names, they're at Mayo Clinic, but this person didn't want birthday cake on their birthday, and I will tell you, I eat a whole birthday cake on my birthday because I celebrate every birthday. So 2 meals a week, and in fact, one of our guests here, I won't say names, I see her every weekend at a restaurant, and one weekend, it was a weekend when I was really craving something, I thought, she's going to see me eating this and think, oh, she's a hypocrite, and I was like, nope, because I tell every patient, 2 meals a week, and if you ever see me out, don't judge, because I'm a real person too, but ordinarily I eat very healthy. My family, if they're listening, they would agree. So let food be thy medicine, let medicine be thy food. Hippocrates was our first doctor, and this is what he said. So thousands of years ago, he knew this. How did this fall out of translation to modern day medicine? We don't train medical students about nutrition. We just train them to fix the problem. Well, you can only fix the problem for so long. You have to fix the cause, or you have to fix the aspects of the disease that can come back again. So let's talk about foods that really matter. And for me, I think a very important vegetable is cruciferous vegetables for breast cancer patients, especially our hormone receptor positive breast cancer patients. So the first question I get is, can I take it in a pill? The answer is no. That's the magic bullet, and there is no magic bullet. Okay, the magic bullet is everything we're talking about today, your lifestyle. So cruciferous vegetables are rich in fiber. They have tons of vitamins, folate, minerals. The phytonutrients, these bioactive compounds, are like chemotherapy in a plant. I mean, look at these words. They're just like chemotherapy. You can't even pronounce them. So the glucosinolates, they make sulforaphanes, indole-3 carbinol. It's really important to get these important bioactive constituents in your diet. Now, the other thing that matters is when you get vegetables, maybe some are better raw, maybe some are better cooked. And when it comes to cruciferous, do you think they're better raw or cooked? Who thinks raw? Who thinks cooked? Okay, you guys are really smart, I think, because I know all you. Okay, so yeah, raw. Raw is better for the cruciferous vegetables, okay? Lots of antioxidant, anti-inflammatory, and detoxification properties. We see high dietary intake actually lowers other diseases like stroke and heart disease. And so what do breast cancer patients die of first? Do you know the majority of breast cancer patients don't die of breast cancer? They die of heart disease. Yes, I read your lips. You were saying that in the audience. You're right. So we got to remember that we do a pretty good job with the cancer, but we got to think about these other diseases that can be lurking in the background. So it's kind of cool to hear that cruciferous vegetables are even good for the heart. Large observational studies suggest that cruciferous vegetables may be associated with a decreased risk of breast and pancreas cancer. So we look here, so okay, great, so it reduces the risk of cancer, but hey, you should know I've already had cancer, so how does this help me? So in the Women's Healthy and Eating study, we had 1,435 breast cancer survivors, and we saw that those that ate more cruciferous vegetables had a lower risk of breast cancer recurrence in the women who were on tamoxifen. Now, we didn't see this powerful of a benefit in women who weren't on tamoxifen, but this study was looking at the tamoxifen versus non-tamoxifen arm. Still, I would encourage women to eat cruciferous. But then we look at this next study after breast cancer polling project that had a really large number of patients, and we didn't really see this benefit of improved outcomes. So we're getting a little bit of this inconsistent result. And we think that there could be these genetic predispositions where maybe 2/3 of the room is going to benefit from cruciferous, but there's 1/3 maybe that doesn't get this huge benefit. So what I would say is eating cruciferous is never going to harm you. It can only possibly benefit you. And until we're able to individualize your diet, then I would really recommend you have maybe 2 to 3 servings of cruciferous vegetables a day, preferably raw. I know that can be a little hard. Okay, so we're going to go on. So carotenoids. Carotenoids, you know, the first thing we think of is carrots, but actually carotenoids are in pretty much every single vegetable you eat. They're ubiquitous, but a lot of really impressive breast cancer research in carotenoids. So the Women's Healthy Eating and Living study showed that carotenoid intake was significantly associated with a reduced breast cancer mortality. Yay! I mean, that's exciting. The Nurses' Health study with 32,826 women at 10 and 20 years showed that those with higher concentrations of these carotenoid components had 18 to a 28% lower risk of breast cancer. So here's a question, can I take it as a pill? The answer is no. And we actually see that when people take carotene supplementation, not necessarily this research was done in breast cancer patients, but when we look at lung cancer patients, male smokers actually had more aggressive cancers. And we also saw more aggressive prostate cancer. We also saw that there was an increased risk of death from cardiovascular disease. So again, stay away from beta-carotene. Beta-carotene is just one of the carotenoids. So what happens is if you take beta-carotene pill, you kind of don't allow the body to absorb all those other carotenoids you need from your diet. So again, diet is the priority. Do you all know what this is? These are soybeans. I get a call every week. I got a call earlier this week. Dr. Mussallem, can I eat soy sauce? I miss soy sauce. Yes, you can have soy sauce. First of all, there's no soy isoflavones in soy sauce. But here's the bigger take-home message. Soy is actually incredibly beneficial for all of you. So the American Institute for Cancer Research and the American Cancer Society supports that 1 to 2 servings of whole soy foods is safe for both breast cancer survivors, whether you're ER, meaning estrogen receptor positive, or if you're estrogen receptor negative, and the general public. So we need to demystify this fear that's been propagated in the media that soy causes cancer. It's actually very good for you. But what matters is the quality of soy. So what kind of soy are you eating? So whole soy would be soy milk, tofu, edamame, soy nuts, tempeh. Okay? Whole soy would not be the cereal with high protein that has soy protein powder in it, or the fake meatballs that are soy isolate, or the fake this, fake that. That's all fake soy. You also probably want to look on the label for soy to make sure it says non-GMO, because a lot of soy products are overproduced nowadays, so you do want to get the non-genetically modified products. Soy intake may reduce the risk of early-stage estrogen receptor-positive breast cancer, recurrence in postmenopausal women on tamoxifen or aromatase inhibitors. Big study. Important study, statistically significant studies right there. So again, the larger majority of our patients have hormone receptor positive cancers. A very large number of our patients, and a lot of you joining us today, are on tamoxifen and aromatase inhibitors. We see these studies where soy would be beneficial. Now, I am definitely being quite bold about my message here, so I want to make sure you talk to your medical oncologist, because each individual patient may have unique concerns, and there may be a reason your medical oncologist doesn't want you on it. But you could take these research studies and show your medical oncologist, and they may have a different thought. The big question to ask is, when is soy most powerful, most beneficial? When you're young. So I give my daughter soy milk. I give my daughter soy all the time because we know that powerful benefits when you're young. The bad news, only about 30% of Westerners, when they first start soy in their diet, really get that robust benefit of their gut bacteria able to actually process soy into that favorable end product. But it's still very beneficial, and it's a nice alternative to meat-based proteins. Avoid soy supplementation. I probably don't have to say any of that anymore, right? I've said it enough. Here we look at the American Institute for Cancer Research. We see that they're showing that there's limited evidence, but the evidence that is available is suggesting that 12 months after a breast cancer diagnosis, women who consume soy have a reduction in all-cause mortality. Again, you could take a picture of this slide and take it to your oncologist if you're listening in today when you have that conversation with your medical oncologist. Anthocyanins and pterostilbenes, these are the phytonutrients in berries. The Nurses' Health Study with over 75,000 women followed for 24 years showed an 18% reduced risk of postmenopausal estrogen receptor negative breast cancer for every 2 servings per week that was consumed. And this was a very statistically significant study. There was also in the same study a 31% lower risk in women consuming 2 servings or more of peaches or nectarines a week. Now, unfortunately, there hasn't been enough data on breast cancer survivors and how we can lower the risk with berries in that population, but again, it's not going to hurt you. There's favorable evidence to know that in the prevention studies, it looks very nice. We also know that there's a lot of benefit with brain health, and so I think from the brain health standpoint, as well as cardiovascular health standpoint, we should encourage berries. So green tea, laboratory studies. So laboratory studies mean they're being done on animals or in a petri dish, okay? They're not being done on people yet, but the laboratory studies are really exciting. When we get to the human studies, again, a little bit inconsistent, but it's hard to do good quality studies in humans. Powerful antioxidant and anti-inflammatory activities that can tend to reduce cancer therapy side effects. Laboratory studies, again, suggest that the phytonutrient in green tea, which is the EGCG, epogallocatechin gallate, may actually be synergistic with some chemotherapies. That's exciting. Most of you are done with your IV chemotherapy, but the trastuzumab, some of you continue that for out to a year, and tamoxifen. When patients consume the actual green tea extract as a supplement, there has been reports of liver problems, but when you drink it as a beverage, it's very safe. Again, avoid supplements. So I always get the question, should I do organic? I mean, this is a personal choice. The research is mixed. It would be pretty challenging to do a properly designed study on if organic is better than not. So it's up to you. I would say that the Environmental Working Group provides this list every year. You can download this app to your phone if you go to this website. And I think it's nice because the Dirty Dozen list in red are the vegetables and fruits you would want to try to buy organic if it's something as a personal choice that was important to you. But when we look at the Clean 15 list, it doesn't really matter. You can buy it either way. So I just want to share this with you. I think this is information a lot of patients seek. Whole grains. Again, when the nutritionist comes, she doesn't like grains, but I like grains. So this is what's fun, and this is why we're going to have a panel, because it's important to have opinions, and it's also important to listen to your body. So, if you have a lot of inflammation and autoimmune disease, then grains may not be good for you. But when we're looking at just the cancer research, whole grains matter. They're really, really good for you. There's a wide range of protective substances, antioxidants. It helps to regulate favorably hormonal effects, which is important in breast cancer. It binds carcinogens, and it improves the gut microbiome. And so, but gosh, that's a buzzword. Every day I wake up and there's a different study on gut microbiome. Someone write a question on that for us. We'll talk about it, okay? And we'll get Debbie, our nutritionist, up there, because her and I love talking about the gut microbiome, and we see eye to eye exact on what our thoughts are with the gut microbiome. But we see study after study after study that looks as high versus low fiber or whole grain intake that there's a reduction in cancer risk. It reduces the risk of colorectal cancer very profoundly, and it may also reduce against the risk of gastric cancers, which would be GI-related cancers, breast cancer, endometrial cancer, and prostate cancer. The goal is to get very high levels of fiber, 40 to 50 grams a day. And by the way, this doesn't have to be from grains. You get a lot of fiber from your vegetables and fruits too. So bottom line is eat grains, get fiber. Grains don't cause cancer. Here we see again from the American Institute for Cancer Research, again, limited evidence, meaning there's not a lot of studies, but the evidence that is available is suggestive that when you have a high-fiber diet before a diagnosis of breast cancer, or when you resume that high-fiber diet after breast cancer, of course, try to stay on it during treatment, but we try to be pretty forgiving because we know during treatment sometimes you're just not able to eat as well as you want to, but it improves overall survival. It reduces all-cause mortality. So fiber is great. So milk. So in the Life After Cancer Epidemiology study by Kaiser Permanente, over 1,800 patients, we looked at what does milk do? Well, we saw that high-fat dairy actually increases breast cancer-specific and all-cause mortality, but not low-fat milk. And actually, when you look at the studies for low-fat milk, it actually looks incredibly favorable. So keep that in mind. Again, there's a lot of controversy around dairy. A lot of people feel dairy is very inflammatory. I would say that when you look at the bone health studies, the only way to ensure keeping your bones good and strong is to get calcium from your diet. And probably the best way to get calcium from your diet is from dairy. So I'm old-fashioned. I think that low-fat dairy is appropriate. Maybe there's a role for organic low-fat dairy because I think maybe it's those cows are taken better care of, and you may end up with a better product. Okay, so this is a problem, and I know all of you probably at the beginning of October saw this research. What do we do now? So here I always tell my patients, don't eat so much red meat. Cut out your red meat. My husband, honey, don't eat so much red meat. You've probably seen us. My guest in the audience that always sees this restaurant, he always gets red meat, doesn't he? And I'm always like, you can't get that red meat. So here we get the study in the Annals of Internal Medicine that says, guess what? Doesn't matter. However much red meat you eat, keep on doing it. This is bad, bad, bad. A lot of controversy about this publication. It turns out the first author on this publication had accepted research grant money several years before, outside of the 3-year window. So when you do research, you have to disclose any money you make within a 3-year period of time of your publication. So his money was earned from the Agricultural Society in 2015, and this is 2019, so he didn't have to disclose it. But the problem is it's kind of a conflict of interest. We know that the large bodies of medicine and evidence that guide red meat consumption know that red meat is not healthy for you. You can have some, but you shouldn't have as much as you want. So top health organizations and global cancer experts are urging the public to continue to follow the recommendation to limit red meat to no more than 3 portions a week and eat little, if any, processed meat. We definitely know processed meat is a carcinogen for colorectal cancer. And these recommendations are based on solid evidence from randomized controlled trials and long-term epidemiologic studies. And we're talking about the improvement of overall chronic disease from a cardiovascular standpoint, from a diabetes standpoint, and from a cancer standpoint. So again, we're fine if you have some red meat, but it shouldn't be unlimited amounts. So I'm sorry for this controversy that the medical establishments have put out there for our consumers, because it's incredibly consuming. And unfortunately, I think that it betrays your trust in us in terms of what do we believe. But I think we stick to the basics and what we've known for many, many years. Okay, so let's just look at a few studies here. Again, no breast cancer survivorship research that's solid enough, well-designed enough for me to say, if you reduce your red meat, You're going to live longer because of it as a breast cancer survivor. But what I am going to share with you is the risk associations that we see in the prevention data. And this is an important study because a lot of us have children or grandchildren. So when we look at red meat in adolescents, we saw that there's an association with a significant increase in premenopausal breast cancer risk in women who consume the highest versus the lowest amounts of red meat. And this is a 43% increased risk. And by replacing one serving of red meat a day with a non-meat substitute, something like a non-red meat substitute, like poultry, fish, beans, nuts, was associated with a 15% lower risk of breast cancer and a 23% reduced risk of premenopausal breast cancer. This was in the Nurses' Health Study. So we look at processed meat. Again, knowing processed meat is a carcinogen for colorectal cancer. Some early suspicions with it being also a concern for other cancers, breast cancer being one of them. But here's a meta-analysis. What's a meta-analysis? That's when we take a bunch of research studies and we review them, and then we take that data and provide it to you. And so we look at a bunch of studies that looked at patients moving forward. So they looked at these patients and they started measuring their amount of red meat eaten. And they found, again, those with the highest versus the lowest amount of processed meat consumption had a 9% higher risk of breast cancer. So some would say, and again, going to the Annals of Internal Medicine, you know what they say? That's not a big enough number. That number doesn't really matter. It's too small. But it matters if you're making multiple lifestyle changes, right? And that's what this is all about, is an overall lifestyle change. Little steps, but multiple changes. So we look at postmenopausal women, those who have 50 grams of processed meat per day. So how much is that? That's about 2 slices of ham. We saw that there's a 64% higher risk of breast cancer in the UK women's cohort study. That was a huge study of over 35,000 patients. So when we eat meat in Florida, because we have the sunny weather, we cook on the grill, and we know that's a big problem. And so we see large case control study of women who consume very well done hamburger meat, bacon. Who puts bacon on the grill? I thought that's so weird. But they did it in the study. Or steak had a 54%, 64%, or 221% increased risk of breast cancer. I presented this data in another presentation, and I had the individual who was going over the site say, oh, Dr. Mussallem, you have an error. It says 221%. I said, oh, no, that's right. It's a lot of risk. And so what about survivors? So high intake of grilled, barbecued, smoked meat may increase breast cancer mortality. So this is something very important by about 23%. So this study had a little bit over 1,000 people. So what about fish and omega-3s? This data is looking really favorable. We see that in a study of over 3,000 women with early-stage breast cancer followed for 7 years, those with the higher intake of EPA and DHA, those are the omega-3 fatty acids found in fish, found in food, and you see here I put in capitals, right? Dietary sources, that there was a reduced risk in overall mortality and a reduced risk in breast cancer coming back. We see in a small randomized pilot study suggests that 3 grams of omega-3 fatty acids decrease bone loss in women on aromatase inhibitors. That's exciting. And we've known for years that fish oil can help to maintain muscle mass in patients that are undergoing chemo, but we see that in these weight loss phases when it's really hard to maintain that lean muscle mass, sometimes when you're dieting, that fish oil can also possibly contribute some what we call anabolic effects or muscle building effects. So I would recommend discuss with your doctor if fish oil is right for you. For some of you, it may be. There was a study that the publication came out actually today reflecting on the fact that maybe fish oil supplementation actually does decrease cardiovascular mortality. So I think that's very favorable. And again, we want to keep in mind the heart in all of our breast cancer survivors, since the heart is something that can be a bigger detriment in our overall life expectancy. So fasting doesn't mean eating fast food. So do cancer cells care if you're hungry? Well, actually, maybe. So a 13-hour prolonged overnight fast reduced breast cancer recurrence 7 years after breast cancer diagnosis. So what if you fasted for 12 hours? You lost the effect. So it has to be at least 13 hours. So that's very, very important. We think this benefit is from the insulin glucose axis, as well as women sleep better when they do this fast. So this is incredibly easy. I tell every one of my patients to do this. Why wouldn't I? It's so easy to do this. So you stop eating at 7 p.m. and you can start eating at 8 a.m. You can have tea without any sweetener, not even non-nutritive sweeteners. You can have coffee without any sweetener or cream. You can have water. Okay? Fun. Okay, so the next thing is, okay, don't throw things at me for this one. Limit alcohol consumption. This is when most people say boo, and this is true. So alcohol is a carcinogen, and it's attributable to 6.4% of all breast cancer cases. So 6.4% of all of these cases don't have to happen if those women didn't consume alcohol. But what really matters is how much you drink. But let's talk about breast cancer survivorship first. So what does this mean for me? Well, I've already got my cancer, so can I keep on enjoying my wine? Well, let's talk about it. So studies have linked alcohol consumption to an increased risk of breast cancer recurrence and to developing a second breast cancer in the opposite breast, but it doesn't mean you're going to live less long because of it. So if you enjoy a small glass of wine, 5 ounces, by the way, it's a small glass, or one beer, or a mixed drink, maybe you can have 2 to 3 a week, and it's not going to cause detrimental issues. What I would say is that if when you do that, you're uniting with friends, you're enjoying yourself, it's a pleasurable time, well, I think that companionship and that enjoyment probably trumps the risk. That's what I would say. But again, we know that any alcohol consumption still does contribute risk, but at the bottom line, our goal is to be on earth as many days as we're intended to, and if it's not increasing your mortality, then we probably have to be careful how hard we push on this. Now, if we're trying to lose weight, I would say you shouldn't drink alcohol because it's an empty calorie, right? So you definitely need to get it out of your diet. So it's a hard one. I think you have to individualize it yourself and how important alcohol is to you. I never want my breast cancer patients, it seems like most of you drink wine if you're drinking anything, but to have more than 5 ounces of wine, that's the serving size, and so you have to get better about how big your pour is. Most people do not have 5 ounces. They usually have more like 9 or 10, and that's 2 drinks. So be mindful of the serving sizes. Do not use supplements for prevention of cancer. But let's talk about this. So vitamin D supplementation and prevention of cancer and cardiovascular disease. Oh my gosh, how appropriate. This is exactly what we've been talking about. So we look in the red here. Supplementation with vitamin D did not result in a lower risk of developing invasive cancer or cardiovascular events. Okay, but you guys have had cancer, so let's look at the next slide. Vitamin D supplements and cancer incidence versus mortality. So among patients with cancer who had higher vitamin D levels, they lived longer after their diagnosis. So which patients have the highest vitamin D levels? Probably those patients that are out in the sun, running, enjoying life. So when we give a pill, maybe it doesn't fix that. I don't know. Let's look at the next study. Because, right, my bottom line for every slide so far has said supplements don't work. But this is kind of interesting here. So vitamin D supplementation and total cancer incidence and mortality. So we find here that with supplementation, we actually are reducing cancer mortality, dying from the cancer, but we're not limiting the occurrence of cancer or the incidence of cancer. Okay, so maybe for cancer survivors, vitamin D supplementation is appropriate. I mean, you know, you've got to look at these studies now. Next month, there may be another study out that's going a different direction. What I recommend here is have your vitamin D checked. If your vitamin D is less than 50, and certainly if your vitamin D is less than 35, then I think you need to get out in the sun a little bit more as long as your dermatologist is okay with it. Spend some time in nature. It's really good for you. And maybe you need a vitamin D supplement. The majority of our cancer patients have issues with bones, and so that in and of itself may be a reason to consider vitamin D supplementation. But optimization of the blood level is important. Okay, so we talked about a lot. We talked about this whole thing here. You know, breastfeeding. We know that breastfeeding is very important for reducing breast cancer risk, but that's not pertinent to our conversation today. So when we put all this together, what happens? So the first study, I highlighted in pink because this is a study in breast cancer survivors. We see here that when women abided by the majority of those recommendations we just talked about, okay, those with the highest AICR, American Institute for Cancer Research score, had a 33% reduction in all-cause mortality and a 37% reduction in total cancer mortality. That is cool. I mean, that is inspiring, that is empowering, and I could probably just stop there. That gives me goosebumps. I get so excited. The one in blue is colorectal cancer. So, and the other ones here are just all-cause mortality and total cancer mortality studies that had cancer patients in it. But I highlight you to the Iowa study because that was a breast cancer specific study. So let's look to the next slide. So, okay, so you're telling me I live longer if I live better, I'll take that. And I'm also telling you that you're going to live longer, but you're also going to feel better while you're alive. So we're like fulfilling your vitality. So victory, right? Now I'm getting to be a good doctor, because this is what we're supposed to do, is cure a disease, which we're great at doing with breast cancer, right? Especially when we find it early. But help our patients live bigger and better lives afterwards. And my goal with breast cancer is maybe you live longer because you got the diagnosis, right? Because you start to live a healthier life than you ever did before. So the American Institute for Cancer Research, they don't go into things like sleep. So I think we need to look at other pillars of health. I think you need to make sure you're optimizing your sleep. The goal is 7 hours a night. Do you snore? Do you sleep with your TV on? Is your room cool enough? Are those hot flashes waking you up? Oh, that's a good segue. By the way, so for hot flashes, if anyone's having hot flashes, we are doing a magnesium glycinate study. And it is my study, and I want patients in this study. So if you are interested, send me a portal message or see me after, and I would love to put you in. So that's you. So, okay, that was good. I should have did that in the beginning. That would have been a good icebreaker. But I knew I needed just a little break, so I just think that's so cute. So you gotta live, and when I was driving over here, I put the music up really high. I always have these playlist songs. I was like, someone sees me. It was that song, the Cup song. Wow. If people only knew what I did in my free time, I tell you. I live, I have fun. I think it's so important. I think that moment when you hear those songs, I don't know, I get goosebumps. I even get tears in my eyes. I mean, that's like the experience of feeling fully alive. That's what we want. But 47% of our day is spent with our minds wandering, going into these bad thoughts, bad. And this is kind of how it looks, right? And then we do this, right? And what happens? That sweet, dear conversation that our daughter or son is sharing with us, or maybe our spouse is telling us, we don't even hear it because our mind is so full with all this clutter. So what do? How do we clear that mind? Should we just clear that mind totally? Is our goal to empty it? No, it's not to empty it, but maybe we can get rid of those disturbing thoughts and instead fill them with kinder thoughts. And that's kind of the premise of mindfulness. And we have a mindfulness expert that's going to join us on the panel, Kristen Lothman, and she's now here at Mayo Clinic to help guide our patients through this mind-body acceptance to really optimize your overall mental health, resiliency, and probably most difficult aspect of your cancer journey, right? It's the unknown, is how we deal with how our mind's going to handle things after our treatment's done. So you all received a book, the stress-free book that Dr. Amit Sood wrote. So let's ask ourselves this question. You can just answer this in your head, but in the last 24 hours, how did you feel? Did you feel extremely distracted, like that picture? Like you had all these things in your mind? Were you able to focus sometimes, but you still got easily distracted? Were you able to focus, and you didn't really get easily distracted? Or were you able to focus, you didn't get easily distracted, you often looked at others with kindness, right? So we're emptying the mind, but we're filling it with kinder thoughts. Or I consistently had undistracted, kind, non-judgmental presence, plus all those good thoughts. That's the goal. So assess where you are now and determine what changes you want to make. And so I invite you to enjoy that book. We have our mindfulness expert here. The majority of you were diagnosed around the time that we were doing our integrative pilot. And so a lot of you had the opportunity to do our SMART training. And so you've probably already been introduced to these concepts. But here's our concepts. So, number one, joyful attention. So maybe when you wake up in the morning, you express gratitude. You give thanks to something that's special for you. Okay? I gave thanks, honestly, that I was able to be here today because I have been so excited for this day. You have no idea. I mean, really, this is my purpose in life, is to just try to help others live a life that has meaning. So let's try that. When you wake up every morning, just before you put your feet on the bed, just give thanks to something. This next one I'm not good at, so I made myself good. I'm not good at this next one. It's called the 3-minute rule. So for instance, when we get home, I have a teenage daughter. So when I get home, the first thing I could do is judge, right? I mean, like, why is your hair like that? Why are your shorts so short? Why blah, 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 blah? Why are you eating that? Actually, that's what I always say. Why are you eating that? That's not healthy for you, blah, 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 blah. But maybe I need to pause more and instead just say, how was your day, honey? I missed you. It's true. When we do that, we feel better, and they're probably going to respond better, too. Kind attention. Let's do this one right now. Send your wish to me. Okay. Send a silent good wish for 2 seconds. I'm kidding. Don't send it to me. Send it to someone else that's important in your life. Oops. And the next is intentional thinking. And so the next is we want to align our daily thoughts with higher principles. And so here's our higher principles. Okay? And again, you'll be able to go through this in the stress-free book. I'm going to go to the next slide. And the first principle on Mondays was gratitude. And so I want to just pause here and thank these two amazing women. Dana Haley is our senior research coordinator. She's in the back of the room in the pink. Without her, I would not have been able to put this together. So thank you, Haley. And this beautiful family to the right is our administrative assistant who's been so helpful, Olivia Lucas, poor thing. I've texted her, emailed her. I don't even put Dawn at the bottom or thanks at the bottom. It's just like 2 syllables of what I need done nowadays. So the poor thing's been inundated. So it's with gratitude. I thank both of you for your contributions and helping with this. So let's talk about mindfulness-based stress reduction just really briefly, because I just want to highlight the study and the importance it has and the benefit it provides. So here's a nice study of mindfulness-based stress reduction. So automatically, I know your minds thought, what does that mean? And so this study, basically what it meant, it was just relaxation or meditation or gentle yoga, prayer, or a daily home practice. And after 8 weeks, we saw that these breast cancer patients had a statistically significant improvement in the amount of stress, in their overall quality of life, and their quality of sleep. Now it gets more cool, right? I love the science, and so we even saw it wasn't exactly statistically significant, but we see that there was a shift in the immunologic profile to a more favorable profile of the immune system being more robust. So that's good. These are learned skills that you can really do anywhere. You can do them walking, sitting, eating, showering, breathing, answering the phone, preparing for a meeting. Sometimes I do it while I'm driving, but I don't put that because I would never want someone to say, I got in a car accident because she told me to meditate. We probably shouldn't do it while we're driving. I do it like if I'm in a really long stop sign or something, but yeah, so pretty easy. Yoga. One of our presentations today is going to go over yoga, but multiple benefits. The American Society of Clinical Oncology guidelines I was fortunate to be a part of. We saw that there is a recommended grade of evidence that is favorable for yoga to help sleep. The Society of Integrative Oncology shows that there's favorable benefit of yoga with stress, anxiety, mood disturbance, quality of life, and post-treatment fatigue. So yoga is great. And guess what? It counts as exercise too. So you're making your body feel better, and it's in stress, and it's even a form of exercise. So what does this slide mean? Purpose. Purpose, what is she talking about? I think this is profound, and this may be the most important slide of everything we're talking about today. And I had a gentleman once come up to me after our Capture the Moment presentation. He said, I really appreciate what you're doing, but I just don't know what to do next in my life. And I said, it sounds like you don't have a purpose. And I think that's a huge problem. It doesn't matter what it is. It doesn't matter if it's volunteering at your daughter's school, or if it's volunteering at a hospital, or if it's helping your neighbor get groceries out of their car. You need to live a purposeful life. It needs to be something that matters. It needs to be your why, right? And I think the reason I've been able to prevail through some obstacles with health challenges is because I have this huge purpose. So find your purpose, discover your why. Compared to socially integrated women and socially isolated women, women who are social, all of you, you're coming here today, you're 43% more likely to have a breast cancer recurrence if you're not